Good evening, ladies and gentlemen. A big thank you to everyone for joining us for tonight's webinar. I hope everyone had a good dinner and is ready for the talk. This talk, Arthritis and Rheumatism, is organized by Sage Counselling Center. Our guest speaker for tonight is Associate Professor Leong Keng Hong, Senior Consultant Rheumatologist at Glen Eagles Medical Center and Adjunct Associate Professor and Associate Dean at U Lu Lin School of Medicine, National University of Singapore. For friends who are joining us here for the first time, this webinar is part of a series that we organize throughout the year. This is part of our public education program. Previous topics include sleep health in seniors, healthy brain aging, and depression in the elderly. We cover topics that are relevant to seniors to enhance their total well-being. So do follow us on Facebook for updates on our future talks such as these. Let me place the link in the chat box for everyone to see. Now, allow me some time to share with you about Sage Counselling Center and what we do. As our name suggests, one of our key services lies in counselling. Center-based counselling is free for Singapore citizens and permanent residents aged 50 and above, as well as their caregivers and family members. We are located at Jurong Point Shopping Centre, right next to Boon Lay MRT station. Secondly, we have the Seniors Helpline, toll-free line 1800-555-5555 that is accessible to anyone that has a phone, regardless of your location. Anyone who would like to have a listening ear or can just call in and share about your challenges with our trained volunteers. It is also okay if you simply want to find a friend to talk to. We also have our public education program where we run activities like today's talk. Other than that, we also organize activities such as arts jamming and other enriching workshops under this program called Active Aging and Awareness Program, where we run activities to try and create space for seniors to explore themselves and explore new interests at an accessible rate, and also to be able to meet other like-minded seniors and to make new friends at this wonderful period of their lives. So last year, Sage Counselling Center has also rolled out a new program called the Community Outreach Program, known as Crest Sage at Anchorvale and Buangkok. This is funded by Agency for Integrated Care, the AIC. We serve individuals aged 18 years and above residing in Anchorvale and Buangkok. Through Crest, our counselling and social work trained staff aim to provide a community safety network for residents to support their mental health. We do this through a multi-pronged approach. Firstly, we create public awareness and education for mental health in the community through roadshows, talks, booths, and other outreach events. Secondly, we carry out functional screenings to screen residents for mental health issues like depression, anxiety, dementia. Lastly, we also provide emotional support to residents with or at risk of depression and dementia and their caregivers through befriending services such as through phone calls or home visits and other meaningful activities. If you are staying in Bangkok or Anchorvale and would like to find out more about this program, do feel free to message us in this chat, in the Zoom chat later on. Moving on, please also note that we have an advisory on personal data protection. During this talk, photos and videos of you may be taken for publicity, training, and marketing purposes. We would also like to gently remind our audience of a few pointers. Attendees' video functions are disabled during the talk. Please also do not record this talk in sound, video, or photography, as the contents of this talk are subject to copyright or may contain sensitive information. And also, anyway, this talk is being live streamed to YouTube. So if you want to re-watch certain parts of the talk, it will be available on the YouTube link. The views and opinions expressed in this webinar are those of the speaker and do not necessarily reflect the views or positions of Sage Counselling Center. If you have questions, please leave them in the chat box below, and we will address them in the Q&A section. So due to time constraints, we may not be able to answer all your questions, so we apologize in advance if we are unable to do so. But so throughout the talk, if, for example, as Dr. Leong is talking and there's something that he said that makes you kind of think about a question, you can post it in the chat box just throughout the whole talk, and so that this makes sure that you don't forget your really important question. So, but we will it's only during the Q&A section that Dr. Leong will be answering your questions. So, without further ado, let me introduce our speaker, Associate Professor Leong Keng Hong. Professor Leong Keng Hong is a senior consultant rheumatologist at Glen Eagles Medical Center, an adjunct associate professor and associate dean, U Llewellyn School of Medicine, National University of Singapore. He has published numerous original articles in reputable journals and chapters in medical and rheumatology textbooks. Special areas of interest include autoimmune diseases such as rheumatoid arthritis and lupus, as well as degenerative diseases such as osteoporosis. His doctoral thesis is entitled Dyslipidemia in SLE. He has a passion for teaching and has won many teaching awards, including Best Tutor for Final Year Medical Students and the Chan Heng Leong Overall Best Teacher Award at the U Llewellyn School of Medicine at NUS. He is a regular examiner for the Final Year MBBS examination, as well as the exit examination of rheumatology trainees. He founded the Osteoporosis Society in Singapore in 1996 and served as its president until 2004. He was the inaugural chairman of the chapter of Rheumatologists College of Physicians, Academy of Singapore from 2004 to 2007, and again from 2011 to 2015. He has previously served for many years as Vice President, Lupus Association in Singapore, and also was on the editorial board of International Journal of Rheumatic Disease. He is part of various panels that have formulated guidelines from the Academy of Medicine, Singapore, on topics such as the use of biologic DMARDs for the treatment of RA, PSA, and SPA, and most recently, guidelines for the use of COVID vaccinations in patients with rheumatic diseases. So that was an extremely a long introduction because he has had many achievements in different positions throughout the year, and so I'm sure that we will learn much from him today because he's such an expert in this topic. So Dr. Leong, I'm now handing the time over to you.
Okay. Yeah, thank you, Amanda, for the very kind introduction. I'd like to also thank Sage Counselling Center for inviting me to give this talk. Y'all can hear me, right? Yeah. Okay, so thank you for taking time to come to tonight's webinar. I know everybody's time is precious in Singapore, but tonight's topic is actually very interesting to many people because it's such a common thing. So the title is Arthritis and Rheumatism. No, but before we start, I would like to know what you all think about this. What is arthritis? What are your thoughts? And so for that purpose, we have some poll questions. So we will get some questions which you can vote for online, and then we'll be able to see what everyone thinks. So the first question that is shown here, question number 1, arthritis is a disease of the elderly. What do you think? True or false? True or false, you can quickly answer. Maybe it will take about 30 seconds only. So quickly vote according to your in the poll function. Okay, so most of you have voted, it seems. So the answer is, most of you think is false. Okay, that's very good. Yeah, because actually most people, when you say arthritis, then they think that, oh, it must be because you're getting old, right? But actually, that's not true at all. So as a rheumatologist, I see people with arthritis, and more than half my patients are young, right? Because there are many reasons for arthritis, which we will cover during the talk. And really it affects the young as well. But of course, the reasons for arthritis may be different for each person. Okay, then there's also another question. Let's see question number 2. Okay, so sometimes we see a family doctor, a GP, or go to a polyclinic, and what brings a patient to see the family doctor? And of course, there are things like cough and cold, aches and pains, cough, diarrhea, right? Out of all these, right, aches and pains, what do you think? How do aches and pains rank? Are they number 1, number 2, number 5, or number 9? Okay, take about 30 seconds, quickly choose one. What do you think? If you don't know, just guess. It's okay. Right? Do you think it's the most common, the second most common, the fifth most common, the ninth most common, aches and pains? Okay. All right. Let's see that. See what you think. Okay. Yeah, so most of you voted for either number 1 or number 2. Well, actually, number 1 is still our good friend cough and cold, right? Yeah, flu-like symptoms is the most common. But number 2 is actually aches and pains. This was done, we know this because Ministry of Health did a survey some years ago about why would a person go and see the family doctor? And actually, aches and pains is a very, very common symptom. Right, so what is the cause of aches and pains? So you see on my slide here, there's arthritis, then there's rheumatism. Rheumatism is also like a common word. In Chinese, in Hokkien is Hong Sit, right? In Cantonese is Feng Sap, right? Feng Shi Bing, right? No, so rheumatism is used commonly by people to say, oh, you got aches and pains in your joints, it's rheumatism. But actually, it's not true. As you see later, there are many, many causes for aches and pains around your joints. But this idea of rheumatism about, when it rains, you feel worse, is it true or not? Well, actually, it is true because the word itself, rheumatism, is derived from Greek language. And what it means is evil wind. So even in the West, not just in the East, people have noticed that if there's some sort of joint problem, when it rains, when the temperature changes, they feel worse. But they just feel worse. It's not the cause of the aches and pains. So we'll find out what are the causes of aches and pains. So let's go on to our talk proper. Okay. So there's arthritis, there's rheumatism, and then actually there's a thing called osteoporosis, which is actually a bone disease, not a joint disease. Right? So, a rheumatologist like myself, what is a rheumatologist? So some people get confused also. They think I'm a physiotherapist or even a Chinese physician or something that treats feng sap, right? But actually, that in medicine, there are different kinds of specialists, right? Let's say brain disease. You have a surgeon specialist who's called a neurosurgeon. Then you have an internal medicine specialist who's called neurologist, right? Because some diseases you treat by surgery, either you chop out the lump or you unblock the tube, right? And then there are medicines you treat with medicine, right? So like in heart disease, there's cardiac surgeon, cardiologist. So the cardiologist treats things like heart failure or high blood pressure where there's nothing to operate on. So similarly, if you have bone and joint problems, the bone and joint surgeon is the more famous one. All of you know, right? He's an orthopedic surgeon, bone and joint surgeon. So the bone and joint internal medicine specialist is me, a rheumatologist. So that's how it works, a bone and joint medicine versus bone and joint surgery, because I treat conditions of the bones and joints that I treat with medicine, not with surgery. Because some diseases are treated with medicine, some with surgery, okay? And so arthritis, rheumatism, and osteoporosis, what is all this? Okay, first let's look at the joints. In your body, there are over 200 bones, and every time you have two bones meeting, there's a joint. So your knuckles are joints, your knee, of course, is a joint. You have joints in your neck and your spine, all over the place. There's so many joints. And so this is a cartoon of a joint where you see that where you see the two bones meeting, right? So in the middle, you have this piece of cartilage, the joint cartilage. No, joint cartilage, when you eat chicken drumstick, let's say, and you tear off the meat, then you see this silvery thing still, no? And that's the cartilage, okay? That's a soft bone that forms a cushion between the two bones. And so inside this joint, you have water, then you have this lining. So anything that goes wrong with all these structures is arthritis. But you see that the joint is also held together by other things. Right? So you have a ligament, which joins a bone to the other bone, right? That's a ligament. Then you have tendons. A tendon is a muscle that becomes this tendon, which then gets inserted into the bone. And then you have these insertions on either side. And so when you contract your muscles, your joint can move. And so if you have problems with ligaments and muscles and the nerves around there and the soft tissue, that's called rheumatism, okay? Soft tissue rheumatism. And so to summarize, arthritis is a problem of your joint. Rheumatism is a problem around your joint. And osteoporosis is not even a joint problem, it's a bone problem. You see, so osteo is the Latin for bone, and porosis sounds a bit like an English word, right? Porous. So porous bones. So the bones are very soft. So if the patient falls down, say just at home, sleep on the floor, something will break. I mean, most of us, if you sleep on the floor, nothing will break, right? But for a person with osteoporosis, they are more prone to fractures. So these are all kind of different things which we rheumatologists treat. But first, let's talk about rheumatism, because rheumatism, as you remember, are the things that are conditions where something goes wrong around your joint. So the ligaments, the tendons, the muscles, the nerve, the bursa, things like that. So there are different kinds. I just list you some common ones. One is work-related rheumatism. So as another name will be repetitive strain injury. So, if you're old enough to watch cowboy movies, remember that last time they used telegraph, right? Because they don't have telephone even, right? So the guy will use Morse code and then send via the lines and so there's a thing called telegraphist thumb. Because they use the thumb all the time. So the thumb gets a bit painful and stuck. That's actually trigger thumb. So nowadays people get trigger thumb. In the modern day, they don't have telegraph, right? But people like to text, they play games on the phone, right? And so they get trigger thumb. And so if you use your hands a lot, the tendon becomes inflamed and then becomes stuck. And then you get this trigger thumb where you have trigger fingers, where the finger goes down and then cannot come up, right? Trigger fingers. So it's all linked to activity actually. And so if you modify the activity, things will get a lot better. And then there's tennis elbow. And if for that matter, there's golfer's elbow. But you don't have to play tennis or golf to get these problems around the elbow because it's also linked to excessive activity. So tennis elbow is because the tennis player does this backhand stroke. But you can get tennis elbow housewives, going shopping, carrying up the shopping bags, or they mop the floor, or they cook, fry things in a wok. So there are other reasons to have tennis elbow and golfer's elbow. Pain around the elbow due to tendon inflammation. Same as housemaid knee, because you kneel down and do things and then you get problems there. Or decravens, which is around the wrist. Again, very common in pregnant ladies because they are not used to handling the baby, bathing them, carrying them. So you get tendon inflammation around the wrist. Another set of common soft tissue rheumatism problems is carpal tunnel syndrome. Carpal tunnel syndrome is a problem where your wrist, there's a nerve that runs through here, and it gets stuck. It gets compressed because the patient uses the hands a lot. So in the morning, they feel very numb, especially around the thumb side of things, and then they shake the hand like that, and they feel better. That's very typical. So that's carpal tunnel syndrome, again due to overuse. Okay. Then lastly, there are other common soft tissue problems. One common thing is plantar fasciitis. It's a long word, plantar fasciitis, but the common nickname term is policeman's heel. In the West, policeman's heel, because it was first described in London. The London policemen, they patrol the streets, and then the shoes are no good, right? So when the shoes are no good, they get problems, and so they get this heel pain, and then in the morning they wake up, there's inflammation, they step on the ground, wow, it's very painful. So for those who have it, I'm talking about. And so in the modern times, who is like a London policeman? People who stand around a lot and walk around a lot. Either they don't wear shoes, like in the house, or they go out and the shoes are not good. So this will be people like soldiers, salespeople, maybe even nurses and doctors, teachers. Teachers stand around the whole time. So plantar fasciitis, right, a common form of soft tissue rheumatism. Then finally, the last example I want to give you is fibromyalgia. Okay, fibromyalgia is very interesting. The definition is very interesting. I give you a definition of fibromyalgia from one of the old classifications. It says this, fibromyalgia is a condition where you have diffuse, widespread pain on the left and right side of the body, above and below your diaphragm. Isn't that interesting? You know, this definition can also be described by a Hokkien term, right? Pain left and right side of the body, above and below diaphragm, that's everywhere, right? So the term is long zhong tia. So everywhere painful. But the reason for this is that people with fibromyalgia, they tend to have very busy lives. So in the day, they're very busy. And worst thing is at night, they cannot sleep, you know. So in the day, they're busy, at night, they cannot sleep. So the muscles have no time for muscle repair. And so they get this problem. And if you do tests on them, on the muscles, it's actually normal. So the way to fix this is to fix the sleep, right? And also people with fibromyalgia, they've got this thing going on called chronic pain syndrome. But some people, when they have pain, somehow the brain centers keep remembering the pain. You know, it's a bit like a condition called phantom limb. You know, phantom limb is when a person, let's say, meets an accident and then the leg gets amputated. There's no leg, no? But they think the leg is still there. So it's a bit like that. There's this persistence of pain. So that can be fixed with medicine, right? So fibromyalgia is also quite a common condition, actually. And so these are all the different kinds of rheumatism, problems around the joint, often linked to activities, excessive or inappropriate activities. Okay, then what is arthritis? So arthritis, as you remember just now, is a problem of the joints, right? So the joints, every time you have two bones meeting, there's cartilage in the joint and something goes wrong. So what can go wrong? So either the joint gets inflamed or the joint wears out. Okay, these two main things. So either it's inflammation, where it becomes red and swollen and painful and warm, right? And also very stiff when in the morning, because when you rest it, it's worse. And that's what happens in inflammation arthritis. Then the other kind would be wear and tear. But this clearly, as you can see, is inflammation. You see this swollen ankle, swollen big toe, it's red. If you touch it, it's warm. It's very painful. Worse in the morning. This, in fact, many of you may even know what this is. This is gout. Because gout is one of the more famous arthritis that people know about. The big toe swollen, you know. So a lot of stories and textbooks and even comics, they talk about this. So inflammation is one. It's either due to gout or due to an autoimmune disease, which we'll talk about. But the other kind, which is also very common, and it's more common as you get older, is wear and tear. That means the joint wears out. So that soft piece of cartilage I showed you in inflammation is swollen, right? In wear and tear is worn out, is thinned out. And very often it may even completely disappear, which makes a lot of problems for the patient. So as you can see, this pair of hands, it looks very knobbly at the end, and these swellings, if you touch them, is very hard because they're bony swellings. Because in osteoarthritis, what happens is when your joint wears out, then your body tries to repair the cartilage, right? But unfortunately, there's a problem in that human beings cannot repair cartilage properly when it's worn out. So instead, it forms extra bone at the site for nothing. See, so these are all bony swellings. If this occurs in the neck, then you get these extra bits of bone coming out, which may compress on your nerves, right? And then you get shooting pain. If it's in the neck, it's shooting pain down your arm. If it's in your lower spine, there'll be shooting pain down your leg. And these things you see on the X-rays, extra bone. Sometimes the Chinese people call it 骨刺, right? As the doctor explains to you, oh, there's 骨刺, there's extra bone coming out. So that's osteoarthritis. Again, osteo, this word means bone, but it's not a bone problem, it's a joint problem. The joint wears out and the body forms extra bone for nothing. So that's osteoarthritis. Okay, coming back then to inflammation arthritis, we'll do a quick rundown on the different kinds. You know, we just show you some pictures, okay? Like 走马看花, right? That's the Chinese term. You just have a brief run through, a quick glimpse of the many different kinds of arthritis. So arthritis is not just one disease. There's so many different reasons. And so as we said, inflammation is either crystal-induced like gout or autoimmune disease, okay? So amongst the autoimmune disease, rheumatoid arthritis is one of the more common. So what is an autoimmune disease? Okay, so the immune system, normally we all have immune system, right? The immune system protects you. It fights germs, right? Foreign invaders. In fact, it also is like an internal security department. It surveys your body for cancer, right? This is the function of the immune system. But in an autoimmune disease, something goes wrong, So the immune system that's supposed to protect you attacks you instead, right? It's like friendly fire in a war. So sometimes the soldiers get confused and they can't recognize who's the enemy, who are your own people, they can shoot your own people, right? It's a bit like that. So autoimmune disease is like that. So rheumatoid arthritis, predominantly, it attacks the joints and attacks young people, right? And women 3 times more than men. Usually starts young, usually starts between the age of 20 to 45 or 50. It can happen in the elderly, but not so common, okay? And this is a pair of hands that has got severe rheumatoid and which has been destroyed. You see, this is all deformities, the wrist, I mean, these knuckles have fallen down, the wrist is still swollen. But this picture, right, we should see less and less of it because rheumatoid arthritis is very treatable nowadays, right? Very treatable. See again, an example of very bad rheumatoid arthritis, but this should not happen anymore. Then another kind of autoimmune arthritis is psoriatic arthritis. So psoriasis is actually a skin disease. You may have friends or family who have psoriasis. It's this scaly, purplish rashes in the scalp, in the body. Sometimes the nails look a bit odd. They can also attack your joints and sometimes the eyes. So this is psoriatic arthritis. You see the swollen joints, the swollen joint. Then you see this is the psoriasis of the skin, this kind of look. And you see this is psoriatic nails. The psoriasis attack the nails, right? The nails look all like that. And then there are times when the psoriasis attacks the whole digit. This whole digit, the whole toe looks very swollen, right? Doctors are very funny people. They give nicknames to signs and conditions. So this toe has been nicknamed sausage toe. I don't know why it's a sausage toe. Maybe a Western sausage, correct? Yeah, not a lapchong. Okay, so you see this sausage toe, right? It's also part of psoriatic arthritis. This is, technically it's called dactylitis. It means the whole digit is swollen. Okay, then you have other autoimmune diseases, and some of these can attack organs, So for instance, scleroderma. So scleroderma can attack the skin. So you see this old lady, her face is quite smooth except for around here. And if she opens her mouth, it's very small because the skin is pulled very tight. And also you see in the hands, it's so tight until her fingers, the tips are pulled back and then they disappear. It's a very serious skin manifestation. But scleroderma is worse than the skin because it can also attack the lungs and also the heart where this pressure is very high. And that can often lead to death if not well treated. And so scleroderma can be very serious too. And then, of course, the thing that I treat a lot of is lupus. So lupus is a condition that affects young ladies, 9 women to 1 man. It can present with arthritis, yes, but it can present with almost anything. So in a way, it's a bit like a big imitator of disease, It can present with rashes, with blood in the urine, protein in the urine, ankle swelling, breathlessness. It can present as anything, even psychiatric manifestations. And so lupus is like a prototype autoimmune disease because it can attack anything. It affects women 9 times more than men and usually young, 20 to 40 something. So as you see, this lady, the rash in lupus is a typical butterfly rash. Why is it a butterfly, you think? It looks like a butterfly, right? Here not much, and then under her nose not much, and then around her eyes not much. Well, the reason for the butterfly shape is that the rash is very sensitive to light. Okay, and so you see that her forehead, this ridge here, acts like an umbrella, so the eye not affected. Then the nose acts like an umbrella, and so this part is not affected. And so it looks like a butterfly. Okay. And of course, if you do some tests, we can find evidence that it's the immune system attacking the cells. This is just one of the tests we do. It can attack blood vessels, to cause color change. And sometimes so bad until even dry gangrene. And so lupus is a potentially serious disease, but in the last 30 years, right, it has changed a lot. So now lupus patients are able to lead normal lives. under the right conditions, they can have children, and the lifespan is not shortened much anymore. I mean, up to the 1970s and 80s, the chance of survival for 5 years is only 50%. Now, the chance of surviving 10 years is 90%. And in fact, many patients live much longer than that. And virtually normal lifespans if it's well controlled. Okay. So that's lupus. Okay, then there are, so far I talked about rheumatoid and lupus, and all those are more common in women, but ankylosing spondylitis is more common in men. And what happens is these are young men, again, young, autoimmune diseases usually young. So it attacks them in the spine. And so you see like this old gentleman, as he gets older, he had AS when he was very young, but now there's all damage. You see his spine is so rigid, straight. So again, colorfully, this is called a bamboo spine, right? You can imagine this looks like a piece of bamboo. If you look at a person from the side, you will see a curve, He has no curve at all, it's all rigid. And then from the side, he's trying to lift up his head, but this is all he can do because his whole neck is fused, okay? Because what ankylosing spondylitis does is it makes the joints fuse up. And so you see over the years, if untreated, it gets better and better. But again, nowadays, there are good treatments for this. And so these are the autoimmune diseases, right, which can cause arthritis. And in some of them, besides arthritis, it can attack organs too. So it can be very serious, which is why us rheumatologists, we are also autoimmune specialists, right? Okay. So besides autoimmune inflammation, the other reason to have inflammation in joints, one of the more common things is gout, right? Everyone seems to know about gout, right? 腰酸, 痛风, right? These kind of names. And actually, gout is where you get this excessive uric acid in your bloodstream. And when it's excessive, it comes out as crystals. And in fact, you can find these crystals in the joint. Let's say if the knee is swollen, we take water out and you look under the microscope, we see these needle-shaped crystals. These are monosodium urate, so part of uric acid. Why does this happen? Well, if you think about it, if you have water, right, you put salt, right, it will dissolve, right? But if you keep putting salt, you keep putting and putting, there will come a point when it doesn't dissolve anymore, and then the salt stay as a crystal, right? So that's the same thing as gout. And so in gout, if the blood uric acid is more than 6 milligram per deciliter, it comes out as crystals. And over the years, as these crystals form, it starts to go in your joint, and then you get gout attacks. It can go into the kidney, you get kidney stones, right? And it can go in under the skin, and you find skin lumps. So that's the problem with gout. And not only that, actually gout is part of a set of illnesses. In hospital nowadays, we hear people talk about 三高, right? I don't know whether you heard about it. 三高, so that means high blood pressure, high cholesterol, high blood sugar, diabetes. Actually, it should be 四高, because gout is part of it. And so in the old days, people thought, oh, the gout got nothing to do with heart attacks, right? Because high blood pressure, high cholesterol, diabetes give you heart attack. Well, it turns out that high uric acid or uncontrolled gout contributes to the heart attacks. So increasingly, it's recognized that for people at risk for heart attack, you must control gout if it's present, right? And so I showed you before, this is typical gout flare, swollen joints. And these are the lumps I told you about. So the crystals form under the skin, and then you see it in the ears, sometimes in the elbow, and then there are those with kidney stones. So the idea in treating gout nowadays is don't just treat the attack, so get painkillers and all that. What you have to do if you get more than 2 attacks a year is to drive the uric acid below this magic figure of 6, right? And once it goes below 6, nothing will happen. There'll be no attacks. If you drive it below 5, even these lumps will disappear, right? So gout is actually very treatable. It's just that somehow it's not treated because the patient doesn't understand. And so treatment of all this arthritis, right, is directed at different things. Okay, so for instance, medication, yes. Surgery is more relevant in this inflammatory arthritis when there's damage already. Let's say the knee is completely destroyed, you can always do a knee replacement. But that's like failed treatment, right? So if you use medicine, you must use medicine not just for pain, but medicine that controls the disease. And that's very possible nowadays because autoimmune disease, we have this whole group of drugs called disease-modifying anti-rheumatic drugs, which don't treat just the pain, it controls the disease. So no inflammation, no damage, right? So it's very treatable. Okay, surgery. Then physiotherapy is important because you have to keep the muscles strong. Otherwise, when the inflammation goes off, let's say your knee is swollen for 2 months, then you treat it properly, there's no inflammation, you still cannot walk properly, right? Because by then the muscles would have become very, very worn out, very, very weak, wasted away. And then your joint hasn't moved normally for a long time, right? So it becomes very stiff. So the physiotherapist is also an important part of the team. Occupational therapists will help you modify your activities. Sometimes they give you aids to aid your activities of daily living. Podiatry is important when the feet are affected because they can adjust your shoes for you. They can make insoles to put inside. Like say, policeman's heel, plantar fasciitis. They can make you a heel cup to support your weight. Then lastly, diet. Okay, so diet can be important, but there's only one condition where you need to avoid certain foods, and that is gout. Okay, that's what we talked about just now. In gout, you have to avoid a lot of things called purines. For other kinds of arthritis, the autoimmune disease, actually is not so important. But in wear and tear arthritis, it is important only in that you mustn't eat too much in general because the weight is a big thing, right? In wear and tear arthritis. Okay, so but for gout, what should we avoid? So people are also very confused about what to avoid in gout. So maybe I ask you yourself what you think. What do you think you should avoid when a person has gout, high uric acid? What should you avoid? Can we see the polling slide? Is this the one that's yes, okay. So what do you think has high purines? Is it niao suan, right? Is it like avoid sour food? Is it avoid organ meat, like all the spare parts, tuateng and liver? Is it to avoid rice or avoid beans? You can choose more than one, no? It's not just one. You can choose all four, you can choose one, whatever, right? So what do you think of gout? What must you avoid if you have gout? 30 seconds. I think this one, a lot of people have the idea about what it is. You just write down what you think. It's okay. No marks are given. Okay. Have most of you answered? Okay, let's see. Okay, so organ meat and beans. Wow, you're very good, no? So like yeah, you attended a lot of health talks, I think, right? Okay, so organ meat is the worst. Okay, organ meat is the worst. So if you rank them, organ meat, goose meat, sardines, anchovy, because you eat the intestine also, right? All these are very bad. Scallop mussel is very bad. Then come the beans, okay, and some of the fish, which is impossible to avoid. So other than beans, there's also certain vegetables, spinach, broccoli, cauliflower. All these are not good. Wheat bran, actually no good. And so the thing about the vegetable group is that people tend to purposely take a lot, because in a way it's true. It's good for fiber, good for your health. But for gout, it's no good. Okay, so for the vegetable purines, be careful. So organ meats are the worst. Okay, by far the worst. Very good. Yeah. So a very enlightened audience. Okay. Okay. So next, we'll go on to this concept of symptomatic treatment and disease-modifying treatment. So like just now I mentioned, never treat anything, just the symptoms, right? Let's say you have a persistent, sudden, severe headache, it lasts for a long time, then you just keep taking painkillers. What if it's due to something serious, right? So you must find out what's the problem, what's the cause, okay? And so symptomatic treatment will be painkillers, but more important to know what's the diagnosis and give a disease-modifying treatment. So symptom drugs are still important because you cannot suffer, right? You don't have to suffer for nothing, right? And also, if you remember, I told you about fibromyalgia. If you keep having pain, after a while, some people develop this persistent pain phenomenon. The pain gets worse and worse. So you can use simple stuff like gels and plaster, koyok. Simple painkillers like Panadol, paracetamol. Paracetamol is actually very underrated. Actually, paracetamol is very safe, right? It can be given over the counter. You don't need a prescription. It doesn't actually do a lot of harm. But there's another group that does a lot of harm, especially in the elderly, NSAIDs, non-steroidal anti-inflammatory drug. This is given because it works fast, and when there's swelling, it works. But if you are an elderly person with poor kidneys, at risk of heart attack, it's a bad idea, because it can make your blood pressure worse. It can make you prone to heart attack, it can cause a stomach ulcer, make your kidney function worse. So you cannot take this for too long, only short spells. You must fix the underlying problem. You know, in Singapore, sometimes you see this phenomenon, people share drugs, you know. So they say, oh, no, my doctor gave me this medicine very good for pain. Why don't you try? Never do that, because that is, for all you know, then your friend has some kidney problem and taking this may drive them into kidney failure, right? So you cannot share drugs, you know, especially prescription drugs. The person must know what's going on, see their own doctor. Okay, opioids, opioids is like opium, or like morphine, that group. But then there are some that are not so bad, so they are approved for use, like tramadol, but still they make you sleepy, like codeine, then cannot pangsai, So there are a lot of side effects. And worst thing in an older person, if you take this group, it makes you drowsy, right? And if you're drowsy and you're an old person, you wake up at night, you go toilet, you may fall down, you break something, knock your head. So it also has to be given very carefully, not cannot anyhow give. Then the last thing that people use for very severe inflammation, for instance, is steroid. Of course, you can inject the steroid straight into the joint, or you can give it by mouth. But if you give it by mouth, there are a lot of side effects, a lot. I mean, on the one hand, if you take steroids, enough of a dose, you will feel better, right? The pain will go down, the swelling will disappear. In fact, your appetite improves. And to most people, my appetite improve is a good thing, but it's a side effect, right? And so if you keep taking, then the patient's face become round, the moon face, You still keep taking, then you get high blood pressure, diabetes, cholesterol, infection, TB, cataract, all sorts of things. And which is why sometimes uh, non-prescription medicines, but especially some from other countries, but even those imported as alternative medicine, sometimes the health science authority, they do spot checks and they find steroids inside. And then they say, oh, this thing is banned, that thing is banned. So again, be very careful. If you take something from a friend who bought it somewhere, don't know where, and then you take it, you feel, oh, a lot better, it could be steroid, right? So that's something to also remember. Steroids, we use in a controlled way if we have to. Let's say the immune system attack the kidney, in lupus, we have to use steroid. But once it's controlled, we will cut down to a low dose. And we never use steroids alone. We also use other medicines to control the disease. Okay, so steroids must be very, very careful. Okay. And so disease-modifying drugs, there's so many things. So the autoimmune inflammations, we won't go through in detail, but there are older drugs which can still work, if you adjust it carefully. Then there's this new drugs called a magic bullet, targeted treatment. Because nowadays everything is like that in medicine. So if you have heard oncology, cancer talks, you also find that in cancer, in the old days, there's nothing but chemotherapy, which is you kill off the cancer cells, but you also kill off your own cells. And so there are side effects to adjust and play around with, right? But then for some cancers, there are targeted treatments, which go to the place where the action is. So that is true for autoimmune disease also. And so now we have so many. So for rheumatoid, for AS, for psoriasis, we got all different targets, TNF, IL-6, CD20, JAK inhibitors. I won't bore you all this, but just to say that they're all very, very effective and they don't have a lot of side effects. So some of the older drugs, you have to keep doing blood tests, look at the liver, look at the blood cells, but the newer drugs don't have to. In the old days, the problem is cost, but now some of them, especially this one, has turned into a generic. It's not expensive at all in government hospitals, okay? And just to show an example, so this old man saw me, he's got rheumatoid arthritis. He doesn't have wear and tear. He's one of these rarer people where the rheumatoid started late. So because he's elderly, you see his hands are also swollen because the skin is very thin, soft tissue swelling, inflamed joints. And when I saw him, he was already on one of the older drugs. He was on steroid, and then he was on painkillers. Now he still looks like that. So after I gave him one of these newer ones, after 1 week, you keep your eyes on the screen. After 1 week, he became like this. See, he went from this to this in 1 week. Yeah. So this is the benefit of these newer drugs, and really nowadays it's not expensive. If you go to a government hospital, it's really very cheap. Like for instance, the one shot used to be 1,200 every 2 months. Who can afford, right? Now one shot is $70, right? Yeah. So and also there are government schemes and subsidies and things. But of course, not everyone requires this, right? So the doctor must make the right decision and the choice for you. Not every in medicine is never everybody treat with the same thing. Okay, yeah. Okay, and so cannot just treat the pain. You must also have this accurate diagnosis, and then you have to treat the underlying problem. Okay, let's go on then to some of the wear and tear problems. Osteoarthritis, I showed you some examples. And osteoporosis, I told you, right? Although both start with osteo, they are different. This is a joint disease. The joint wears out, you got extra bone. This is a bone disease. The bones become porous. Because sometimes us in old days, we conduct seminars on osteoporosis, then the audience will ask, oh, I got knee pain, is that osteoporosis? And no, actually that's osteoarthritis, right? Okay, so in an x-ray of the spine, you see normally it will be just either square or rectangular, and you see here is this extra sharp things come up. That's the 骨刺. These are the extra bone, bits of bone that form in the spine joints. Then in your knee, you see, normally there should be a gap, right? But then you see on this side of the knee, there's no gap, no, the bone is touching the bone. So this patient, when he stands up, there's no cushion, so it's very painful, right? And so osteoarthritis affects older people more. Again, a bit unfair to the ladies, it affects females more. And if you're overweight, it's worse. If you have the old injury to the joint, then makes it more likely the joint will wear out. And your family history, if your family has those knobbly looking fingers I showed you, then you have slightly higher risk. And so how to fix osteoarthritis? Unfortunately, osteoarthritis, unlike the autoimmune thing I showed you, they don't have disease-modifying drugs. That means there isn't anything at the moment proven to say, oh, let's slow down the wear and tear or reverse the wear and tear. There's a lot of this kind of stuff on the internet and multi-level marketing, which is all not true. Okay, so there isn't anything that really does that. But still, having said that, the good thing about osteoarthritis is that even if there's no disease-modifying drug, it gets worse very, very slowly. So after 10 years, maybe still around the same. And so in order to prevent it from getting worse, there are lifestyle measures which are very important. Okay, drugs are not so important. Drugs are more for pain relief. Okay, and so what's important is weight control. Okay, why weight control? Because some of your joints support your weight, isn't it? Like what? Like your knee, like the hip, like your lower back, ankles, right? And so if you lose weight, the load on your joints, the weight-bearing joints is much less. But how much less? What do you think? One last poll question. What do you think? So let's say if you lose 1 kg of body weight, how much loading do you take off your joints? Oh, do you have the poll question? Yeah, here it is. Okay, see, so if you lose 1 kg of body weight, also people will tell you to lose weight. I mean, doctors will always tell you to lose weight. Then we say, what is your BMI? What's your ideal weight? And sometimes the patients, to hit the BMI, they must lose like 10 kg. It's impossible, right? But having said that, right, even if you lose 1 kg for the joints, it helps, How does it help? If you lose 1 kg, then the loading will reduce by, what do you think, 1 kg, 5 kg, 10 kg, or 15 kg? Okay. Quickly put your answer and then we can move on. Okay, so when most people have answered, okay, let's see the answer. Wow, wow, you're very good, huh? Okay, you got the correct answer, most of you. So if you lose 1 kg, your weight loading is reduced by 5 kg, So it's almost like if you lose 1 kg, you have let go of a 15 kg backpack. Can you beat that? So there are a lot of patients, a lot of pain, need painkillers and all that. Then they lose 3 kg and no need painkillers anymore. Okay? Yeah, so weight control very important. And so the way to lose weight is a bit tough, right? But to lose 3 kg is not as bad as trying to lose 10 kg, right? And so the first thing you need to do is to reduce carbohydrates. Not zero carbohydrate, not this excessive diets like ketogenic, zero carbs. When you have zero carbs, right, you have high protein, high fat. Actually, it's not a healthy diet. But low carbs, low carbs. So low carbs means half all your carbohydrate portions, right? So if you eat one big bowl of rice, eat half, right? You go to the hawker center, order noodles, right? Maybe don't finish the noodles, If you have 2 slices of bread, cut to 1. And you have half all your carbohydrates, you can lose 2 to 3 kg. Yeah, and that will be very good. Okay. Okay, so weight control. Then the second thing is to exercise, make the muscles around these joints stronger. So they will protect your joints, right? Because it's the muscles that make your joints move. So let's say the knee, you know which muscles make your knee work? the thigh muscles. The thigh muscle is very important, called the quadriceps, right? So there are many good studies that show that quadriceps exercise really benefits the function of people with osteoarthritis of the knee. Your knee is worn out, you work with the physio, strengthen your thigh muscles. If not, the best exercise is actually cycling, right? Because cycling helps to strengthen your thigh muscles, but you must sit a bit higher. That means your knee must never go more than 90-degree knee bend, right? Similarly, when you do squatting, you cannot squat all the way down. That's no good. Half squat is okay. Half squat. For instance, Tai Chi, but not all the way down. So if it's the spine that is a problem, then swimming is very good. Okay. So you need to exercise the muscles. And then appropriate shoes, because shoes, the worst shoe is a slipper. So if you have to walk a lot, go marketing, walk around a lot, don't wear slippers, because every time you take a step, the slipper is going to drop off, right? And in order to make it not drop off, there's a lot of fine movement that your body is doing to adjust, and that will strain your knee. So what you need to wear if you have to walk a lot is a sports shoe kind of shoe, right? A covered shoe with laces that gives you good support for the whole foot, the heel, the arch, and the front. Okay, and that would be the best shoe to wear. Then walking aids. Actually, if you only have one side painful, let's say the left knee is a problem, the right knee not so bad. Actually, walking aids are very helpful. So if your left knee is painful, you buy a walking stick and hold it on your right hand. But I can't demonstrate to you how to use the stick. You ask your doctor or your physio, but it's very helpful. But unfortunately, in Singapore, I think in many Asian countries, people don't want to use walking stick. Because they say, oh, makes me look very old or something like that. But actually, it really, really, you can walk twice the distance much easier. But you can discuss it with your doctor. Then lastly, adjust activity level. Some people, they are very sporty people, so they run marathons. Then when they're 50, they still want to run marathon. When they're 70, also want to run marathon. So I think there's a time where you may want to adjust the kind of exercise you do. So the older you get, the less high impact things you should do. Yeah. Okay, so then let's go on. Okay, so medication, I told you, is not important. All they do is like symptom relief. To slow down progression, glucosamine has always been touted, but really no proof at all over the years, and even less proof for all the other stuff. Green lead muscle, pro collagen 2, all kinds of things. Then there are some injections you can do into the joint to make the cartilage firmer. But this kind of buys time. It may actually help you for 6 months to a year at the most, and then it won't work anymore. Okay, and so it's generally a bit expensive, so it's not really recommended. I mean, it may be good for a patient who's stuck on painkillers, cannot come off it. Then by doing this, they can reduce their painkillers, they can work harder with the physio, strengthen the muscles, and then maybe there's a role for it, but not for everybody. Then for those who are really bad, you can do surgery. Actually, surgery is very good. It really makes a big difference to the patient's life, especially hip replacement. But knee replacement also, they do very well nowadays. It's not like the old days. In the old days, when knee replacements first came out, the thing only lasts for 7 years, the prosthesis, the artificial joint. And now it lasts for 15, 20 years. The new hip replacements can last almost forever because they're made of some ceramic material. No? It actually lasts very long. So you can discuss this with your doctor, the orthopedic surgeon. Yeah. Because if you're when to do an operation would be determined by how well you function, not by how bad your x-rays look. Okay. So like say there are a lot of things you want to do, you cannot do, you cannot travel, you can't visit your friends, and after a while you can hardly go down to the market. Then it's time now, because it's for the quality of life, right? Yeah. So this is something to consider and discuss with your doctors. Okay, so osteoporosis next. So osteoporosis is a disease of the bone. So this tells you what it is. On the left side of the screen, you see normal bone, a very healthy bone struts all joined up. It's an electron microscope. Then on the right, you see, wow, this is broken, the strut is broken. And not only that, the strut is so thin compared to these struts. You see, this is so thick and nice. This is all thin. So like a scaffolding of a building. It's going to fall apart anytime, which is why when the patient falls down, they get fractures. And these falls are called fragility fracture or low impact fracture. That means if you fall off a ladder, it's not counted, because even a young person might break something. So this is fall from a standing height. So you just walk around your house, you fall down, then something breaks. There's something very suspicious. Okay. And so this old lady, unfortunately, has spine fractures, multiple, get this hunchback. Because if you have a spine fracture, then the front is usually affected more than the back. And so after a while, there's a curve, right? And then she's also needs a walking frame because she also broke her hip. Okay. So in osteoporosis, you start off breaking the wrist, then you still don't do anything next time. Next, the spine will get fractures. Still don't do anything, the hip will get fractures. So there are also good medicines nowadays to prevent fractures. So osteoporosis is not inevitable. Not everyone who ages has osteoporosis. It's not just about taking calcium, right? Because calcium alone is not good enough. And it's not just that you must wait until a fracture, then you treat, because you can predict who's going to get a fracture by doing certain tests, like a bone density. So you can make an early diagnosis and treatment is pretty effective. So one way of knowing, like, should you do a bone density is if your age in years minus your weight in kg is more than 20. So if you're a small size person, it's worse, So let's say you're 70 and your weight is 40 something, you're at risk, okay? Then secondly is you ever had a fracture after very little trauma, right? You fall in the bathroom and you went A&E, they say, oh, your spine is squashed. That's an osteoporotic spine fracture. You already have osteoporosis. No, don't even have to do tests, And then you really need to take something to prevent further fractures. Or you have a family history, someone in the family, especially your mother, had a fracture. Or if you are the kind of person where you have a condition where you need long-term steroids. Transplant patients, some autoimmune patients. Yeah. And so to prevent osteoporosis, there are lifestyle things. You can make sure there's enough calcium and vitamin D in the diet. Actually vitamin D is not found in the diet, no, it's only found in the sun. So you should measure it, and if it's low, you can replace it. Then there's weight-bearing exercise, like walking, dancing, these kind of things. And then lastly, you try not to fall down. How not
I
to
can't help you with that.
How not to fall down is that at home, people tend to fall in the bathroom, right? Because it's slippery. So you need to have non-slip mats, right? Then at night, older people tend to wake up to go to the toilet. So if it's very dim, they cannot see, they fall down. So you need a night light. So these are simple measures, which you need to instill to start to prevent fractures in older people. Surgery, well, if the hip breaks, you can do surgery, but the outcome is not perfect, because there was a study done in Singapore in one of the government hospitals. These people came in with hip fractures, and before they fell, they were quite well, and most of them are fit for surgery. So after surgery, in fact, 20% didn't make it, in the first year. Then of the rest who didn't die, 50% were not mobile, either bedridden or wheelchair bound. So it's quite a serious disease. Vertebroplasty is when you get a spine fracture, it's squashed and they try to inject cement inside to blow it up again. But this helps the level of the fracture, but it won't prevent fractures. So you still need medicines to prevent further fractures. And so the many medicines, some will prevent only spine fractures, some prevent spine and hip fractures. So this one, you need to discuss with your doctor to know what to take. And so these two are diseases of wear and tear, more common in elderly. Osteoarthritis, a joint disease, osteoporosis, a bone disease. And so they're actually not the same thing, but both are more common as you get older. Okay, but then of course, both you can address and you can treat. So you need to fix things early. Right. And so in summary, ladies and gentlemen, I think we talked a lot about arthritis and rheumatism, different causes of aches and pains. So the take-home message is that rheumatic pain is very common. I'm sure all of us have, at some point of time, have aches and pains, right? But then there's so many causes, right? Some is due to rheumatism, that means problem around your joints, tendonitis, nerve entrapment. Some of it is due to arthritis, either wear and tear, or if you're a younger person, swollen joints, inflammation, right? Inflammation either from gout or from autoimmune disease. But then there's so many advances in therapy, as I've shown you, especially for autoimmune diseases. And so the idea is to fix things with safe and effective drugs, not just symptom relieving drugs, but having to treat the underlying disease with disease modifying drugs, right? And then once that happens, everything should be much, much better. And very often joint damage can be prevented. And so the take-home message again is that arthritis and rheumatism are very common, so is osteoporosis, but they all can be treated. So it's a matter of awareness and coming to attention at the right time and taking the right measures, and if need be, medications. Right. So thank you very much for your time. So pass the time back to Amanda.
Thank you, Dr. Leong, for your insights. I hope everyone has taken away something useful from his talk. Before we proceed to the Q&A, we request for your help in giving us feedback so that we can continue to provide free webinars for all. There is a short poll being shown on the screen with 4 multiple choice questions. Does everyone see it? Do drop a comment in the chat if you have trouble seeing it. So please take a few minutes to complete the poll. For those watching this webinar on YouTube, there is a link in the About section which will lead you to the feedback form, so you can fill it up now or after the webinar. We will start the Q&A right after this, so don't leave yet. Thank you. Everyone, the polls are over. If there's anyone who hasn't finished voting yet, the feedback survey form will be displayed automatically on the screen after the webinar ends. I have also just commented the feedback form link in the Zoom chat. Now, Dr. Leong will take over the Q&A. Please drop your questions for him in the chat. You can take your time to think about any questions that you have for him, and advice you may want to ask for him as well about arthritis and rheumatism. It's at the I hope you're able to access it. It's the chat function on the Zoom page. If you have trouble commenting on it, do also try and let us know as well. Thank you.
Okay, so we can start the Q&A, is it? Because there are 2 questions there. Okay, so let's start then. Okay, there's one on that asked me, is Arcoxia NSAID? NSAID is non-steroidal anti-rheumatic drugs. So generally, the answer is yes, because there are different kinds of NSAIDs. So Arcoxia is a part of a group called COX-2 inhibitors. The idea is that COX-2 inhibitors are a bit better in terms of like the effect on the gastric, so less likely to get gastric acid. But on the other hand, it is still has the same issues with NSAIDs, other NSAIDs, in terms of the effect on the kidney, the heart, the blood pressure, and the water retention. So it's still everything I say about NSAID will apply to Arcoxia, or even to the other one called Celebrex or Celecoxib. So it's mainly for symptoms only. So you shouldn't take it long term. You must find out what's going on. Okay, that's one. Okay. Next one is okay. I see you've moved it from the Q&A. Okay, so the next one is, I'm on methotrexate and prednisolone now. Is it safe to consume prednisolone for a long term? Okay, no, so prednisolone is like a two-edged sword, but there are some instances where you may need to be on for a bit longer. And in those instances, then the doctor will try to bring it down to a safe maintenance dose, right? A safe maintenance dose is 5 milligrams a day, right? And so like some of our severe lupus patients, they are on 5 milligrams a day for many years, and actually nothing much happens. What should not happen is the prednisone is at higher doses for a long time, like say 10 milligrams and above for a long time. Then inevitably along the way there will be side effects. And so you need to work with your doctor as to whether you really need the prednisolone and whether something else can be added to bring it down. But it could be that in your case, it's necessary. So you have to discuss with your doctor. But just to say that preferably not long-term, but if long-term, then a safe low maintenance dose, like 5 milligrams or less. Yeah. What are the root causes of these problems? What problems? How to avoid? Okay, so arthritis and rheumatism is there's the root cause. It's different, right, for different people, different conditions. So like I said, arthritis is either inflammation or it's wear and tear. So it really depends on what you are suffering from. If it's inflammation, it's either gout, which is a crystal problem, or it's autoimmune disease, right? Yeah. Is there anything else to the question that maybe whoever wrote it can elaborate a bit? Okay, so will walking daily for 1 to 2 hours cause wear and tear to the knees and legs? Okay, this is a good question. So people, there's this dilemma, this paradox, right? They say on the one hand, my joints are worn out, so I should not overuse it. Then how am I to exercise? Well, actually, sensible regular exercise is still important because you need to keep your muscles strong, right? And you need to keep your joints moving for mobility. So in fact, the Arthritis Foundation of America one time had a motto, no? It says, move it or lose it. So that means you cannot be so sedentary and then your muscles become weaker and weaker. So depends on how severe your arthritis is. 1 to 2 hours may be okay for some people, but for others, when it's very serious, then we have to be modified. No? So it's good for you to check with your doctor and your physiotherapist, right? Okay, what else? I have regular shoulder pain and some issue with my C5-6. Okay. So this cervical spondylosis is osteoarthritis of your neck joints. Remember you said there's osteoarthritis, which is wear and tear, right? So in this case, cervical, which is neck, spondylosis is another term for osteoarthritis of the spine. That means you have osteoarthritis of the spine in your neck, okay, the neck part of the spine. And C5-6 means the level of the spine that's affected. Because you have C1 to C7. You have 7 pieces of this backbone, this vertebrae. In between, you have a disc and the joints that link them up. So in this case, at the level of 5 and 6, there's wear and tear. And so then there's extra bone. So when the extra bone comes out, then it will press on the nerve, right? And C5-6 applies up to your shoulder. That's why you may have neck pain radiating to your shoulder. So that's what it is, a wear and tear of the C5-6. Okay, yeah. Okay, then I have one finger inflamed on and off, uneven and brittle. Is that psoriatic arthritis? Better when I apply essential oil. Okay, so nail changes alone, right? It's very hard to tell whether it's psoriasis or not because it can just look a bit odd, like what the picture I showed you. So other than psoriasis, there are other conditions that cause nail changes. So for instance, fungus infection is a common other reason. So fungal infections can also cause funny looking nails. And so if you're not sure, again, you should check with your doctor. But if it's just nails alone, then you can just fix it on its own merit. And if it doesn't work, you should see a skin doctor first, right? But in your case, you applied essential oil and everything was fine, right? Yeah. Okay. I didn't miss any along the way, right? Okay, how to differentiate arthritis flare versus edema? Okay, so an arthritis flare is like, assuming you're talking about inflammation arthritis, so a flare in the joint would be a swollen, painful joint. Sometimes it's red. So let's say your ankle joint, it's the ankle that is swollen and red and painful. Edema is water retention. So that means from the toes upwards, it looks swollen. And then when you press it, there's a depression that takes a long time to come back. Right? That's water retention. Right? And usually edema alone, there's not much pain. Right? Yeah, so that's how you tell the two. Okay. Okay. The next one is also quite a good question because it's quite commonly asked. Is it true that taking calcium and vitamins are useless after 25 before you no longer absorb calcium. Okay, actually it's not true. So for osteoporosis, the lifestyle changes are relevant whether you have a low risk, a medium risk, or high risk osteoporosis, right? So calcium intake, preferably from diet, dairy products are actually okay. Calcium supplements, you must be careful because if you overtake it, it's actually no good. There's some evidence it may lead to increased heart attacks. But so calcium is important because it's a building block of your bone. Vitamins, especially vitamin D, is very, very, very important. And so if you are at low risk, all you need is calcium, vitamin D, exercise, and that's good enough. If you are older and you really have osteoporosis, you still must do all the lifestyle changes, but you may need medicine, right? That's how it works. Okay. If I have young kids and I want to help them have healthy bones and joints, what advice to give them? Well, I mean, young people nowadays don't drink much milk, so I think a lot of our kids have quite low calcium intake. But maybe more to encourage the calcium intake. Vitamin D is usually less of an issue because they're usually in the sun more than us adults. So there's really not that much we can do. I mean, just healthy lifestyle in terms of the bones, calcium intake, and vitamin D. Is frequent bending down bad for the spine? Yeah, okay. Is frequent bending down bad for the spine? Well, depends on what you mean by bending down. Okay, so let's say if you have osteoporosis of the spine, that means your bones in the spine are weak. It is no good to carry things from the floor with a bent back, because you might actually break something, right? Actually you can get spinal fractures in the spine, right? So be careful how you lift things when you are at risk for osteoporosis. But other than that, if you have wear and tear, osteoarthritis, then again, it depends on what you're doing when you're bending down. And so to strengthen the spine, you need to strengthen the spine muscles, do swimming, or you can do Pilates to make the spine muscles stronger. Right? Bending down per se is okay, but bending down to lift something from the floor is very bad. Okay, yeah. What's the next one? Oh, is it true that jumping rope ruins your joints? Oh, okay, so interesting. No, I don't think so actually. I mean, if you are quite healthy, jumping rope is okay when you're younger, you know. But when you're older, then again the same principle applies, right? There's still a lot of impact and jumping and all that. So as you get older, probably is less good. You want to move to something lower impact. Yeah, but it's a reasonable exercise when everything is fine. When you're young and healthy, it's good for your heart and lungs, coordination. It's all right. Does cracking your joints cause arthritis? Okay, actually, the answer is no lah. I think no. See, because cracking your joints, like people like to crack their knuckles and make this noise, right? So noisy joints without pain is actually okay. Huh? But if your knee wears out, then those of you with knee wear and tear arthritis will realize when you move your knee, it also makes cracking noises, right? But then there's pain, you see. And so if you have cracking noise with pain, it's no good. If you just have cracking noises, you haven't exercised for a long time, then your spine makes some noise, it's actually okay. Yeah. Is D3 needed? Yeah, so D3 is a common form of vitamin D that we can get from medicines in Singapore. You can also take D2, but it's less common here. Anyway, D3 is more efficient. So even over the counter, you can get D3 tablets, usually 1000 IU, but it's no good to anyhow take. I mean, if you just want to take without checking the level, you should take like 1000 will do. But if you check the levels and you're very, very low, then in fact, the doctor may actually give you a higher dose, right? So it depends, right? Yeah, if you go into the sun 20 minutes a day for a long time already, then it's fine, right? But if for much of your life you haven't been in the sun, then you should just check it. Okay, is there any other supplement to replace glucosamine and chondroitin? How effective? Yeah, so glucosamine has been quite controversial in that there isn't any good studies. In fact, the only reasonable study is sponsored by the drug company themselves. I mean, the supplement company. So in the National Institute of Health, they did another study on glucosamine, then it didn't seem to work. So glucosamine effect is not is very uncertain whether, okay, I think it's almost certain to us doctors that it doesn't slow down the arthritis, but whether it contributes to pain relief is much harder to say. So I guess the practical advice is because it is harmless. If you take glucosamine, you feel better, right? And you don't take glucosamine, you don't feel better. It's okay to take because I don't think it causes any harm, right? You must not underestimate the effect of placebo in arthritis, because when you take something and you feel better, as long as you feel better, it's fine. Um, should I explain? Okay, so let's say when we want to know whether a medicine works or not, right? We always compare it with something called a placebo. That means there's nothing in it, right? So if you have high blood pressure medicine versus a placebo, the effect is very obvious. Right? The high blood pressure medicine will lower your blood pressure. The placebo will do nothing at all. Okay, but in arthritis trials, in pain trials, the placebo has a beneficial effect. Very often the pain is less. But of course, when you take an effective painkiller, it's even better, right? So the placebo effect is reasonable when whatever you're taking is harmless. Yeah. My shoulder pain can be unbearable. What can help? Okay, so this is a bit tough for me to answer because there are many reasons for shoulder pain. Shoulder pain is very prone to injury. It's very prone to strain and overuse. This thing called frozen shoulder, right? Is due to overuse. So this one you really need to check with the doctor to see what's the problem, right? Is hip surgery dangerous? As you mentioned, some of them did not make. Oh, no, okay, so sorry. Okay, I need to clarify this. I'm talking about hip surgery for those who had fractures of the hip. That means when you fracture the hip, they use surgery to fix it. But because these are elderly patients and osteoporotic, it doesn't work well. If you do hip surgery for wear and tear of the hip, it's different. If you do a hip replacement surgery because the hip has worn out, that surgery is very, very good. No, it's very effective. And nowadays you stay in hospital 3 days, you get out already. And then after a month, you can walk without a walking aid. After 3 months, you're very, very much better. And go traveling and everything. Yeah. How much calcium is considered safe? Okay. So calcium intake, the recommendation is 800 milligrams a day. But see, in the Singapore health survey, they find that even for us who don't drink milk in Singapore, our average daily intake, 600 already. So if you want to supplement, you don't supplement more than 500 at the most. Because if you take 1,000 milligram of calcium, then you end up too much. And the evidence shows that calcium supplement in excess can contribute to increased heart attack. Okay, so you mustn't overdo things. What food or vegetables provide calcium? Oh, usually the leafy vegetable group, leafy vegetables. Yeah. And some bean products. But of course, remember bean products is no good for your gout, right? Okay. Next, osteopenia is probably recommended. Okay, osteopenia, we didn't go into detail, but your bone density is either normal or it's got osteoporosis or you got something in between called osteopenia, which is low bone mass. Okay, so low bone mass, for some patients, they will need treatment, some they don't need treatment. So the doctors have this fracture risk assessment score, which we can work out for you. What's your chance of fracture in the next 10 years? So even though you have osteopenia, but you've got a lot of other risk factors, and your chance of fracture is high, then yes, you need medicine. One of the medicines is like you said earlier. So this one you need to discuss with your doctor. But if your risk for fracture is low, then don't treat yet. Right? It's like anything, right? Before you need treatment, don't treat, right? Because sometimes it may be worse. Okay. Okay. A comment from Mr. or Mrs. Tam. Yeah, thank you. I was diagnosed with D deficiency. Will there be an impact on my bone density? Oh, yes, for sure. If your vitamin D is low, it does contribute to osteoporosis, but it also contributes to something else I call osteomalacia, which is a bone problem due to low vitamin D. But fortunately, it's very easy to fix. If you do a blood test and your vitamin D is very low, just replace it. It's almost impossible not to fix, because you can give the right amount, then you check again, then you're normal. It's very easy to fix, right? You cannot replace vitamin D insufficiency or deficiency by going into the sun. Because a lot of people with very low levels, right? What has happened is for decades, you don't have enough sun. Then you wonder, hey, Singapore very sunny, how come like that, right? Whoever goes in the sun, right? You go to work at 7 o'clock, you come back at 7 o'clock, no sun. For 5 days of the week, no sun, right? So it's very common actually, low vitamin D is very common in Singapore. Okay, so the vitamin D low can be a problem, but it's very easy to fix. Okay. Some have said glucosamine will affect blood sugar level. Oh, yeah, it's a myth lah. It's a myth. Glucosamine is not linked at all to glucose, so don't worry about that. Yeah. Yep. Oh, okay. Okay, well, we went through everything. Did we finish everything, Amanda? I think so. Okay. Any other thoughts? Any other things?
I think there are two more questions in the Q&A
Oh,
function. I can just read out. So, what is taking 600 mg calcium daily safe?
oh yeah, okay, I see that. Okay. Yeah, so 600 milligram of calcium is what's found in a lot of common brands, Caltrate, for instance. If you take one tablet a day, it's usually okay lah. Because if you assume that your daily intake is about 600, and then so you take 600 is 1,002 lah, so it won't be near 2,000, right? No, but if you are the kind that takes dairy products every day, cheese, yogurt, low-fat milk, then you may not even need calcium at all. So if you work out what is your calcium intake and you're 800 to 1,000, then you don't even need calcium supplements at all, right? But if you don't take dairy products, then usually you will end up being about 600 only. Then you can supplement a little bit. Yeah. Is there another one?
There's one more question. I think this will be the
Yeah.
last question. Any daily, is it acupuncture massage or acupoint massage
Oh,
that can improve or alleviate joints and muscle
ah,
aches? I think that will be the last ones. Yeah, last
okay.
question. Yeah.
Okay, so this is a good point. So acupressure, trigger point release and all that, which the physios do, can be helpful, right? So sometimes when you have a joint that's painful, what happens is the muscles around the joint tighten up. This is a natural response from your body to try and protect your joint. So all the muscles around there tighten up. Then if this happens for a long time, like 2-3 months, then your muscles become weak because they're constantly in spasm, right? They're not being used, right? So the physiotherapist needs to break up all these knotted up muscles and then teach you how to exercise to bring back the strength in all the other muscle fibers. And so that can help. But still, it is still a problem of symptom relief. You must find out why is there joint and muscle aches to start with, right? If it was an old injury and then you didn't get rid of the pain fast enough, then maybe the physiotherapy alone will work. But if there's something underlying that to fix that's causing the constant aches and pains, and that must be looked at. Right? Yep.
I think so. I'll just take maybe thank you, Dr. Leong, for your talk and the Q&A and also answering each question so thoughtfully. Um, so yeah, I think now I'll just do a quick recap about our main services at CH Counselling Centre. Centre-based counselling is free for Singapore citizens and permanent residents. You can also call us to find out more. We also have the Seniors Helpline, a free helpline with an easy-to-remember number, 1800-555-5555. So that's 7 fives. If you know of anyone who needs a listening ear, do call the Seniors Helpline. Now, let me share with you about a really exciting upcoming workshop that will start next Tuesday. It is a course on mindful self-compassion, teaching you to be kind and compassionate to yourself rather than overly self-critical or overly self-judgmental through the tool of mindfulness. This course is in Mandarin from 10 a.m. to 12 p.m. on the Tuesdays for 12, 19, 26 November and 3rd December. I think this will be a really excellent workshop where you can learn a lot of very important tools to face challenges in life, manage stress, and also improve your well-being. So yeah, do consider signing up for this talk. The sign-ups are going to close very, very soon by this Sunday. So if you want to sign up, do click on the link which my colleague will post on the chat, and do click on the link and sign up by this Sunday evening to join us for this workshop. If you have any questions, feel free to WhatsApp me at 8510-9809. Okay. Yeah. So all the information is also on the Zoom chat, and you can click the link from there. Also, do watch out for our upcoming webinar in January next year. It'll be the new year on 2nd January. And so if you want a good start to a whole new year of 2025, do join us for this webinar on sleep health and health by speaker Dr. Tan Xian Ming, who is a senior consultant psychiatrist at Sengkang General Hospital with an interest in sleep disorders and mental health. If you're interested to learn how sleep affects your health, do register for this talk. You can sign up from the link which my colleague has dropped in the Zoom chat, and for those who are watching on YouTube, the link can also be found in the YouTube About section. For those people who have registered for this talk and have been receiving emails, this information for both the talk and this upcoming webinar will also be included in the follow-up email. Alternatively, if you want to know everything that Sage has, sign up for our mailing list to be informed of all our activities, like our upcoming talks, our other activities, and other center updates. And I believe it's like the next slide, the mailing, to show the mailing list. For any other questions, we are just an email or phone call away. Thank you once again for joining us, and have a good night, everyone. Thank you. Goodbye, everyone. Have a good night's rest. Bye-bye.